Did you know that many women who receive an abortion are more at risk for miscarriages later in life due to complications that can occur during the procedure? This could possibly be avoided if these women had quicker access to care in the case of an emergency. Admission privileges for abortionists could do just that. This topic is relevant to me because it affects the safety of many women around me, and I believe every medical clinic I have access to should have equal safety measures and regulations. Over the course of the past semester, I have been doing extensive research on the topic of admission privileges, making me qualified to share my stance on this subject with you today. Throughout this presentation, I will be advocating for the implementation of admission privileges for abortionists across the country. First, I would like to explain admission privileges as a whole. Then I will discuss the two intentions governors have when implementing these laws in their states. And lastly, I would like to discuss the main reason these have failed and a minor change that would need to be made in order for them to be both successful and effective. Many aspects go into a person's decision when choosing a physician. These are accessibility, location, experience, and insurance. However, an aspect that is often forgotten is whether or not the physician has admission privileges. According to Jim Mumper in his 2020 article, a physician with these privileges can admit their patient to a hospital with a simple phone call and very little paperwork. This physician then has the right to check on their patient whenever they need. A benefit of being a patient under the care of a physician with these privileges is knowing that your personal physician is involved in your care and being more comfortable. And while these privileges are not as common today due to the new role of hospitalists, they're still very important for the safety of those patients who utilize private clinics. One of the true intentions of these laws is keeping abortionists in line with other physicians. According to Dave Andrusko in his 2015 article, the governor of Wisconsin says that safety cannot be disregarded in any health profession, including abortion, which has the least regulations out of all the medical areas. Dave Andrusko also wrote an article in 2016 concerning these laws in Florida. Governor Rick Scott said that this law would bring abortionists in line with other physicians by requiring them to have either admission privileges or a transfer agreement with the local hospital. Also in Florida, this would require the health department to inspect at least half of the state's abortion clinics yearly, making sure they are within guidelines. Emergencies and accidents occur in every area of medicine. It is just important to have precautionary measures in place for the safety of those patients. There's always a possibility of a complication in every medical procedure. Since the ruling of Roe v. Wade, the number of back alley abortions has decreased significantly, and the abortion procedure itself has become much safer. However, there are still many potential risks women are at when receiving an abortion. According to Christopher Martinez and his colleague in 2019, some of the major physical risks are cervical laceration, uterine atony, subsequent hemorrhage, uterine perforation, organ injuries, failed abortions, septic abortions, and disseminated intravascular coagulation. They also found that only 2% of these complications result in the woman being hospitalized. And while that number is not large, it is extremely important that these diagnoses are made at a timely manner. Admission privileges would allow that. This graph illustrates the frequency of complications among abortions done when the fetus is less than 12 weeks. The top line is the total complications, and the line going down represent the percent of incomplete abortions, bleeding, and infections, the three main categories of complications during abortions. This shows the different risks women are susceptible to, and government officials across the country are doing their best to keep these women safe post-abortion. However, many states have hit the same wall when enacting this law. Since 1986, at least 9 states have attempted to enact this law. The main concern is that this law will place an undue burden on a woman's decision to seek an abortion. Dave Andrusko talks about Judge Daniel Mannion of Wisconsin in his 2015 article. Judge Mannion says that this does not place an undue burden on a woman's decision, for it only affects the distance she may have to travel. In Dave Andrusko's 2014 article, he says that this law was struck down in Mississippi due to the fact that it may shut down the state's one and only abortion clinic. He also found that over 60% of women in Mississippi who received an abortion traveled out of state already to do so, so it only affected the women in Jackson. Clinics terminated after the implementation of this law would be shut down by hospitals, not the law itself. It is in the hospital's hands whether or not these clinics stay open because they decide who they grant privileges to. This means that there would need to be a change to the law. Therefore, in this law, hospitals would need to provide a legitimate reason as to why they cannot grant a person privileges to their facility. This would ensure that not all clinics within a state are shut down and women would still have access, but safer access. In my opinion, Governor Rick Scott of Florida does the best job in outlining this law because he mentions safety, inspections, and keeping all physicians in line. Once these changes are made, women can experience safer healthcare post-abortion and all clinics will be in line. Today I've discussed with you admission privileges, the lack of regulation in abortion clinics, the risks still associated with medical abortion, and a minor change that would need to be made in order for this law to be successful. While some see this law as placing an undue burden on women, I think we could all agree that we would want ourselves and our loved ones to experience safe healthcare when enduring these procedures. Thank you.